Hi everybody, last and final time I'm gonna try and get Roshan, my friend, and the best OT ever. I have so many questions for him. 1 second, sorry. Roshan is here, he has joined. Hi Roshan.
Hi,
Yeah, I can't.
hi Devangana. Am I visible?
No, you're not visible.
What's going on? Yeah,
Now
now
you're
I think
visible.
you
Now
can
you're
see me.
visible.
Uh,
Now don't do anything. Now you're visible.
but unfortunately, you are not visible to
That's
me.
totally
But
fine.
anyways, I think
I'm,
let's
you know
let's
what,
start.
Roshan, you know what? I'm so visible. I'm always posting selfies on my Instagram, so no one cares to see me anymore. You are important. So you are visible.
Okay,
That's amazing. Yay.
thanks.
Okay.
Thanks.
So Roshan, I'm going to quickly introduce you and then we will get started. Okay?
Sure.
Awesome. Okay, so Roshan and my first job ever in my whole life, very, very, very long ago, was at Vasant Valley. I used to be a special education teacher in a first grade classroom. It was super cute. And I used to take my three little girls and one Down syndrome boy and all of them up to Roshan for OT. He was on the top floor and he just did miracles and magic with them. So Roshan has now like come a long way, of course, as all of us have, and he has a master's in occupational therapy and neuroscience, a bachelor's degree in occupational therapy. He has a sensory integration certificate from the University of Southern California. He's the director of Therapy for Ability Center and Therapy for Ability Early Intervention Program. And he's an expert in pediatric occupational therapy and interventions based on occupational science. I can't even speak so much because there's so much stuff that Roshan has done. So I'm very excited, Roshan. I don't know about anyone who listens to this, but I am personally excited because I've been in the space of autism since you and I've known each other, which is
Exactly.
like 16, 17 years. And every second day I'm talking about OT. So I'm super excited for this. So let me first let you introduce yourself and then we'll get started.
Absolutely, Devangana. It's been a very long time. Thanks to the social media that we are connecting again, isn't it?
Yes, yes,
So,
yes,
yeah, I think my introduction is the same as yours because mine and yours was the first job in Vasant Valley, if I'm
yes.
right. And we both actually we started our profession from there only, and it was very
Totally.
gradual that I took it very seriously. But it was a great learning for both of us. It's been nearly now 15 years, I think, Devangna, and
Correct.
I've been working in this field. We are both are working in this field. I don't know how this happened, but it's just that I'm working only with the autistic kids. Though occupational therapists work in a lot of different fields, but I've been lucky that I am just working in lot of with autistic kids. So that's it. I think you have already introduced and you have said so much. I think
That
there's nothing more to say.
that is amazing. So okay, so honestly, I'll tell you like two parts of it. One, there's a lot of parents of kids on the spectrum of autism that I've met, Roshan, over the last 16, 17 years, who actually don't even want to accept that their child has autism, to begin with. So that's one. And two, a lot of parents are just like, occupational therapy kya hota hai? Bhag bhagai, daudi karao, like, football khilao, exercise karo ghar pe. And like they're confused between what is physiotherapy, what's occupational therapy. So just to begin with, what is occupational therapy as in the correct definition and understanding?
Exactly. You know what? This is my favorite question to answer.
I
You know
can't
why?
wait.
Because this is a very it's not with you, it's with
Hmm.
me. When I asked the parents, आप क्यों आए मेरे पास सर, किसी ने बोला था कि ओटी करवा दो, like short form is the OT.
हाँ.
मैंने कहा अच्छा आपको पता है व्हाट इज ओटी, सो दे आर एक्चुअली नहीं, मुझे किसी ने बोला कि बस आप एक बार दिखा दो ओटी कि आपके बच्चों को ओटी चाहिए. So it's a very important question because actually the parents should know
Hmm.
what where they are going and for what they are
Correct.
going, isn't it? So
Correct.
now let's talk about the term occupational. Let's divide this term therapy and occupation. So we all are having some occupations, isn't?
हाँ.
So first of all, let's know the difference between the profession and the occupation.
Correct.
Like I'm an occupational therapist, so this is my profession.
Hmm.
Okay, you are a special educator, that's your profession.
Hmm.
So, but occupation is not the profession.
Hmm.
Occupation means at a certain
Hmm.
age Like right now, I'm about to be 40. So
Mm.
in this age, my first occupation is that I should earn for my family, and my
Correct.
family should lead a very good life. So that's my
Correct.
occupation. So I'm
Correct.
earning through my profession. That's a different thing. So
Correct.
the term occupational therapy means if supposedly any person at any specific
Hmm.
age has a problem because of which he is not able to perform his occupation properly,
Hmm.
then the intervention, the occupation therapy intervention
Correct.
comes. So
Correct.
we will talk about the autism later on. Let's talk about a person who is 60 years of an age. So
Yeah.
do that person needs an occupation therapy? Yes, supposedly if he's having a severe arthritis or he has met some accident
Yeah.
and unfortunately he is physically disabled.
Yeah.
So as an occupational therapist, my role there is to improve his
Correct.
life, maybe reducing the environmental barrier, maybe we have to give him certain adaptive assistive devices to make his life more easier. So
Correct.
he also needs an occupation therapy. Similarly, if a person who is 30 years of age and he met an accident, a spinal cord
Hmm.
injury, he is now
Hmm.
paralyzed, he
Hmm.
used to go to a big MNC company. So
Hmm.
maybe we have to modify his office, maybe we have to modify his house, his position of the computer, laptop, his life. So that's all we need to do. So my goal is to bring back to him in his occupation. So now,
Correct.
let's talk about autism. Why autism needs occupational
Correct.
therapy? See, it's not only about autism. Let's talk about a general population of special need kids. If the child who is not able to perform his occupation properly,
Yeah.
you need a help of an occupational therapist. But here, again, the most important question comes, what is an occupation of a child of certain age? So
Huh.
if I talk about a child who is of 2 years of an
Hmm.
age and a child who is an autistic or maybe same diagnosis of a 7 or 8 year of age.
Huh.
So will the goals be the same?
Hmm.
No, not at all.
Correct.
You know why? Because at the age of 2, the
Hmm.
occupation of the child is to play.
Yeah.
So that means my goal for a 2 year old child
Hmm.
will be to help him to play. That's his
Correct.
occupation at that age.
Correct.
But if I'm working with a 7 year old child who is having the same diagnosis,
Huh.
but I'll not go for much play,
Hmm.
I have to develop his skills at that point. So
Hmm.
the
Hmm.
occupation, the term is the same,
Hmm.
but the goals will be entirely different.
Hmm.
So this is what occupational therapy is. So it's a very big term used in different age groups. And in autism, obviously we know that the OT is a very important aspect.
So tell me, like, basically what you're saying is that if a child is 2 or 4 or 6, occupational therapy's job is to get them physically, through their fine motor and gross motor, appropriate for their age level, based on the goals for that age level. Is that correct?
Not only physically, it's not that the problem can be physically, it can be a behavior issues, it can be some sensory
Yeah.
issues, whatsoever it is. Because at the age of 6, the primary concern of the parents is that my child is not interacting
Yeah.
in a peer group. So
Yeah.
it can be anything. So depending upon the priority of the parents, depending upon uh, like what are the major symptoms which as an occupation therapist I can assess in that child,
Yeah.
so we make the goals.
Got it. Got it. Got it. Now, can I ask you a follow up question to this? Now, suppose like many kids that I've known for the last many years, they have very busy lives, right? Now, after school, if they have 3 free hours, okay, school khatam hua 4 o'clock, they have 3 free hours. They'll go to like tuition or like a special education teacher to do some extra activity. Then the parents are confused. Then they'll go for speech therapy. Then the art therapy हो गई, play therapy हो गया. The parents are confused कि अब इसे मैं कोई sport खिलाऊं, music में डालूं, dance में डालूं कि OT करूं. My
Mm.
question is, how is occupational therapy, Roshan, different from exercise, right? Like I exercise every day. So
Absolutely.
how is occupational therapy different from exercise, which is age appropriate?
Well, again, it's a very good question. See, we basically supposedly, let me give you an example because I
Huh.
think we'll be able to understand better with an example. A
Correct.
child who has a very poor muscle tone, maybe he has any diagnosis, because
Hmm.
in autism we see that the muscle tone is somewhere it's varying a lot. So
Hmm.
supposedly a child who has a very poor muscle tone, he needs a body, he needs a strengthening in his muscles, he needs
Yeah.
a lot of strengthening and to improve the tone. Why he's
Huh.
not going to the gym? Why he's coming to the he should
Huh.
ideally he can use the dumbbells and all those stuffs.
Correct.
But why he needs OT? You know why? The major thing is that when you are training in a gym or when you are training with any other trainers, or if you are doing an exercise, you are not doing a functional exercise.
Hmm.
Again, let me give you an
Huh.
example.
Huh.
If my biceps are poor, suppose that if my shoulder is
Hmm.
poor, and if there is an physical trainer who's doing a lot of shoulder exercises. So maybe he is giving you a dumbbell where you are lifting your shoulder and you are actually gaining a strengthening. That's a perfect way.
Hmm.
That's not absolutely wrong.
Hmm.
Strengthening a child definitely needs, but where's the functionality? A
Hmm.
child who has a good shoulder doesn't mean that he'll be able to write.
Hmm.
So, as an occupational therapist, I have to make a goal where I need to strengthen the shoulder so that the child can have a very good writing. How can I
Got it.
do it? So,
Hmm.
simply if I am a physical trainer, I can give him a dumbbell and I can tell him to do this movement or maybe different movement of the shoulders 10 times, do 4 repetitions, fine. As an occupational therapist, I'm not going to do that. I
Hmm.
need to strengthen, but I'm going to do in a way where I
Hmm.
can tell a child, okay, let's play a basketball. You need to throw a basketball in a higher level. So obviously, when he is doing that thing, there
Hmm.
is a training going on the shoulders, but he is learning one skill.
Hmm.
That is a basketball.
Hmm.
So our eye-hand coordination, the depth perception, the judgment, how far the basket ring is,
Got it.
how
Got
much
it.
force I have to apply. So
Got it.
all these things. So what comes is a functionality.
Got it.
So,
Got it.
and you know what, Devangna, there are a lot of, I think there are a lot of parents who might be there. I need to tell them one thing: work on the functionality. The goal should be to make your child independent, to make your child functional. Exercise is needed.
Hmm. Huh. Exercise is needed. Sorry, you were saying? Huh.
Yeah, so functional exercises is more we need. So
Got it.
suppose at least again a child who is having a maybe poor tone in the fingers. So
Hmm.
maybe a trainer can say that okay, use lot of spring grippers that will increase the strengthening.
Hmm.
Absolutely, but I will say to go for a lot of therapeutic activities and seizure cutting activities because
Hmm.
with strengthening you will get a functionality.
Hmm.
So
Got it.
there's where the
Got it.
occupational therapy is very important.
Got it. And tell me, like, I know you mostly work with kids on the spectrum of autism, Roshan, with a lot of OT, but you've also worked with other clientele in the space of OT. But like, tell me, how does it differ? Like what your focus will be, what your practice will be. Do you like focus on making the stimming less? Do you focus on making their like behaviors? Like, does that help? Like, talk a little bit more about how is OT catered for those on the spectrum.
So, let me know. You want to say that how OT is worked on autism spectrum?
And
Like
how is
that's
it
what the question was.
different from any other kind of OT that people
Okay,
might go for?
okay. So now you know what? For many years,
Hmm.
there was a big question about the sensory
Correct.
issues. Like Jean Iris used to always advocate that in autism the kids have the sensory issues, but it took lot of years, maybe 20 to 25
Hmm.
years, to put this sensory processing disorder in DSM-5. So DSM-5 is basically a psychiatric criteria
Correct.
where they I hope you know that and you can actually say so, where they put the new diseases or maybe symptoms or psychological issues or maybe behavior issues.
Correct.
So it took a long years thanks to Jean Iris who started advocating it. So now the DSM-5 says the in autism sensory issues are very common. Again,
Yeah.
the parents shouldn't be confused. I'm saying in autism sensory issues are very common. I'm not saying that all child who have a sensory issues are autistic
Hmm.
kids.
Hmm.
Okay, these are
Hmm.
different things. So what they have seen now in autism, the common problem is that the kids are having a very very maybe a sensory sensitivities, or maybe they are seekers of sensory. So the primary thing which comes in the OT is to, if the child is having a lot of sensory issues, so
Hmm.
we have to work on those sensory issues to decrease it. But again, it's not that every autistic child is going to be loaded with the sensory issues. There are few kids who have a mild sensory issues. In that case, I would work with Sensi. I would work on the skills like motor skills, gross motor, fine motor, to put him at least near to that age group where he can match with the peer groups.
Hmm.
So one is the sensory issues where we have to work
So can
definitely.
I,
Secondly is the
Roshan,
motor
Roshan,
skills.
Roshan,
Yeah.
Roshan, can I ask you a question? Now, sometimes like because I work with kids on the spectrum for so long, sometimes I'm also confused. Ki, what is a sensory issue and what is like a behavior he's just like using to get out and act out and get attention, right? Like I'll have
Yeah.
a kid who'll do ah in my face. Now I'm just like, is that a sensory issue or like they'll hit the table again and again, right? Now I'm always confused. Is that a sense? And like I've been to some of the biggest conferences, and like there are kids who are just sometimes, or like people who are acting out, and or like they need they like we give them accommodations of squishy ball and things, and I'm just like, do I train them how to survive, like fade out these behaviors, or do they need like sensory integration therapy, OT, SV, speech therapy? Like it's hard to figure out sometimes. What are your thoughts?
Yes, Devangna, it's a very, very, very important question, and somewhere I can't even say whether the child is showing behaviors or it's a sensory issue. But you
Exactly.
answered in a question only. You gave me an
Yeah.
example where the child is tapping a table a lot.
Tapping the table or doing like
And what the
making.
solution you gave was that you gave him a squishy ball where he can press it. No,
No,
now,
no, no.
you know what?
I don't know. The thing is, Roshan, you know me now. Like, I don't rely on this stuff. No, so I'll be like, hold the pencil and write. Like, you, like, write, work, read, use your hands to do some activity. So I kind of like change the direction of the behavior. But I don't know if that's a sensory need he's craving and he needs like some, like, a ball pool or like something like that to relieve anxiety. Like, I don't know sometimes.
Okay, so Devangna, again, we have to see the case. Now, supposedly, there is a case one where the child is tapping on the table,
Huh,
and the moment you give him the pencil, or maybe we can say when you are engaging the child in some
correct.
in a training proper in a proper training. So
Yeah,
what you're doing is basically you are just telling him, okay, just don't do these things, and you have to come back to the functional thing. And in one case you achieved it, like you achieved it. Now you gave him the pencil and he started writing and the tapping went.
huh,
Okay,
huh.
on the second, now in that case, what can, yes, that can be a behavior. Obviously, that can be a behavior to distract, or that can be a behavior to seek your attention.
Correct.
Because sometimes what happens, the parents scold the kids too much that the kids are actually adaptive, becomes adaptive to that school. So they
Yeah,
need that input again and again.
correct.
So that can absolutely be a behavior issues.
True,
But
true,
now
true.
let's try to filter out
Hmm.
whether it was a behavior or whether it was a sensory
Correct,
issue. So if
correct.
you gave him the pencil, he started writing. So when he started writing, after finishing his work, has he started doing his thing again? First.
Hmm.
Secondly, is he doing it throughout the day, or he is doing specifically when you are giving him the writing program, or if you are giving him the thing which he does not want to do that? Because if
Hmm.
it's a sensory issue, it will happen throughout the day. So
Correct,
that's not an avoidance, that's a seeking sort of a thing.
correct.
So again, if it will be a behavior, then you can see that okay, whenever you indulge him into some positive thing, he forget about that negative behavior, and then you get a better result. But if this sensory issue is happening throughout the day and the parents are also complaining, if he's sitting idle, he's still tapping some hard surfaces, or maybe he's still tapping himself. So in that case, we have to analyze. Again, I'm not saying that he has a sensory issue, but again, we need to analyze that thing. Because you know what? It cannot be that only the child is having one sensory issue. So we have a profile, then we have to go through it, because there may be three or four more sensory issues which we haven't taken care of. So when you are going to fill a profile, you can see, okay, fine, he is tapping, but he is not tapping, he is pinching also. And he is not only pinching, then he's putting something in his mouth and chewing it very hard. So that can give me an idea. Fine. he's seeking a pressure, and he's not only seeking with the hand, he's seeking with the mouth also. And somewhere when he's pinching, so he's getting that sensory input in his tips also. So again, it's not an isolated sensory issue that can judge that can say whether the child is having a sensory issues, but there can be multiple things, and
Got
you
it.
have to be a sensory detective to see
Yeah.
whether it's a behavior or. But trust me, in 15 years of my experience, I'm still confused. Sometimes I becomes confused whether it's a sensory issue or it's a behavior. So you need to spend
And
time with the
sometimes I
kid.
think it's a mixture of both. No, Roshan, like I've seen like kids who are very like I make them focus on something very hard. Like, we're doing novel study, we're doing algebra, we're doing difficult math. Like suddenly their behaviors come out. They want to run, they want to throw things. But if I give them like a break after 2 minutes to engage in like a YouTube song or to like scroll on their Instagram or something, like automatically their behavior calms down and I'm able to get them back to work. So, my question for you as an occupational therapist is, what is the difference that you've seen between, like, in 6 months of working with a kid on the spectrum through OT? Like, how they started and then what did you see?
Okay. Devangna, again, it depends upon case to case.
Correct.
Again, it's very hard to answer. But one common thing which I'm seeing nowadays is that as a parent, Indian parents were never like this. But nowadays, the parents have become more and more protective.
Correct.
Okay. So again, I'm going to discuss all the things with examples. It will be easier for us to
हाँ हाँ
understand.
all
Okay.
good.
So two kids came to me with us with a maybe a diagnosis of autism, though we know that we cannot diagnose till the age of 5. So doctors are quite clever. They just write ASD and put a question mark in it. So, anyways, so the child, two kids who came to me with same symptoms, maybe we should use the word symptoms.
Hmm.
And what I saw was that when I gave a same therapy to both the kids, there was one child who developed pretty well, and
Hmm.
there was lot of change in that kid. And there is the other child, maybe he didn't show a good development.
Hmm.
So if I just sit down and try to analyze why this happened, so one thing which comes very common is
Hmm.
the exposure. The
Hmm.
kids who are more exposed to the normal environment
Hmm.
where they can learn through an environment,
Hmm.
they show very good results when we do an OT.
Hmm.
And a child where the parents are too
Hmm.
protective with their kids,
Hmm.
there is a thing which I feel, because you know what? The thing is learning. You can learn only through your environment.
Correct.
And it's very important that the child should have certain milestones at his age.
Yeah.
If he is actually going up and down through his milestone, that means either there is some
Hmm.
neurological issue,
Hmm.
or the parents, nowadays the parents are too protective.
Hmm.
Because of that, the milestones or maybe the natural phenomena of learning is not there.
Right.
So it depends upon, again, case to case. So
Hmm.
when I try to expose few kids and I can see the results just like that, the parents say, sir, ये तो हमने कभी कराया ही नहीं था. So the child, when he just does that things first time, he feels so satisfied. Okay, ये मैं कर सकता हूँ. And that when the child gains that confidence, you can see the entire treatment becomes very easy for the therapist too. और कई बार क्या होता है, the same activities which is an age appropriate activity I'm doing with the child, he's so scared, he's not ready to do it.
Hmm.
And again, जब तक आप environment से learn नहीं करोगे, you
Correct.
cannot be a good learner. तो वो एनवायरमेंट से लर्न करने में रिफ्यूज कर देता है. अगेन आई एम यूजिंग द वर्ड सेंसरी ओवरलोड और मे बी एंग्जाइटी जो कि डेवलप हुई है. So if a child who's having too much of sensory overload, or if he's having a high level of anxiety, will be a little bit poor in learning as compared to the child who has sensory issues but no
Yeah.
anxiety. He's ready to learn because the parents have given him enough exposure to him. So again, this is very hard to
Yeah.
say, Devangna.
Can I ask you a question? So like suppose you like I have some parents who I've known who are just like kuch like we trust you, make my kid do anything, like it's fine, right? Like parents at home also they like really push their kids. My question is like have you like there are rumors that Messi is on the spectrum of autism and like a lot of big footballers and sports stars and all of that. Have you ever like tried to like thought about or like worked with a kid and you're just like isko to main football mein ya cricket team mein dalwa deta hu. Like, have you ever had that? Because like there's a lot of
See,
footballers, and I read their history, and there's a lot of musicians, and I read their history, and it says that they could have been on the spectrum of autism, but they were just pushed.
I feel it's a God gift. It's a natural thing. I'm nobody to do that. If you know what, if the child is showing so much of interest in certain things, like he's obsessed with it, like there are a lot of kids. I just remember one kid who used to play keyboards. He was having a, mind you, he was having a very high auditory sensitivity, but he had that talent where he can play any song. You just need to play any song and he can play it on a keyboard.
Mm.
So that was a given talent. In that case, it was this God gifted talent to him. So it all depends. If the child is enough motivated in certain things, doesn't even matter if the child is autistic or any other diagnosis, he can achieve that thing.
But can I
Okay.
ask you a question, Roshan? But like sometimes a child doesn't know their own talent till the time somebody doesn't like try them out or push them in a certain direction, right? Like there are kids who I thought could never do something, and then I keep pushing them in a certain direction, and suddenly there's a break, and then they start doing it. So I'm wondering, like, for a Messi, who's a footballer, Lionel Messi, like the English Premier League went to his village. They handpicked him. Then they got a surgery done, so he got a little taller. And then he started playing football for the team. But like what I'm saying is that how, like, have you ever thought like some kid is really like picking up at something, and you try to push him in that direction and seen some results?
Absolutely. I think there are a lot of sports personality who has been diagnosed with LD or autism or ADHD,
Huh,
isn't it?
yeah,
I didn't remember the name of an Australian swimmer who got a gold medal in Olympics, and some Phillips. I
yeah,
don't know
yeah.
if I
Uh-huh.
am right or wrong. Okay, so he was also diagnosed with maybe a high level of ASD or maybe an ADHD. He was there. You
Mm-hmm.
know what? So the child had that capability where he used his hyperactivity in certain functional thing.
Correct.
So what he did, he knew that I can channelize my hyperactivity if I can swim. So
Mm-hmm.
it was the child, it's very hard for us to make anything like that. It all depends upon the child. If he feels satisfied of certain things, and as a therapist, then we need to see, okay, this is a thing which is satisfying him. You can sit with the parents, say, see, this maybe like I have given you example of a person who was playing a child who was playing a keyboard. So we sat there, and then the parent started the keyboard classes with, and now that girl is superb. She's a very good singer, and she plays the keyboard pretty well, and I'm
Oh,
very
good.
proud that I'm her therapist. So I can't display the
Yeah.
name, but
No, 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 that's
that
great. Like that's the
so
magic.
and you know what? It's not because of me, it's because of the efforts of the parents. I just try to give the direction to the kid,
Yeah,
and
that's
trust me, it was superb. Now
that's
that child, again,
amazing.
mind you, she's an autistic child. She
That's
still has a
amazing.
diagnostic problem, and she cannot communicate. She cannot speak. She can speak to and fro with you and having a very poor eye contact. But still, it was so proud for me ना that again मैंने उनको बोला कि just try this thing. They tried and the child was ये child ने करना था because he or she loved it तो उसने कर लिया.
That's amazing. I
Hmm.
love that so much because like you didn't think like her proper parents also probably didn't think 3 years ago that this is where her future or she would be, right?
Hmm.
So that's just amazing. Okay. Um Tell me something like you've studied neuroscience, and you've touched on all of this. How does your brain activity or like brain change because of like the right kind of functionality added to your movement and to your routines?
Okay, so I have two answers to it. First, as you have said that you have done neurosciences, let us discuss a little bit about the term neuroplasticity.
Correct.
I would say every
Correct.
every therapist and every parent to go and read about this term neuroplasticity. So, what is the meaning of neuroplasticity? It
Yeah.
means if supposedly I'm doing certain things which I am doing it for the first time.
Yeah.
So the stimulation of the neurons in my brain will be much more. So that stimulation, actually what happens is that when too much of neurons are stimulated, our brain is actually expands a little bit. So that expansion is very, very, very important because there will be expansion. That means the neurons are getting stimulated and you can absorb more and more things from the environment. That's called learning. Okay. So the thing is, first is that in a neuroscience, if I'm doing something with a child which is functional, which is the thing which is creating an interest in a child, there will be a little bit of a neuroplasticity. So
Correct.
why there is a neuroplasticity? Because he is loving that thing.
Yeah.
He wants to do that thing. So that becomes a permanent learning thing for him. That is one of the things. So that is a neuroplasticity. That's a neurological thing. Your brain expands, you absorb more things, and you learn new things out of it. On the second thing, let's talk about a simple computer thing. So what happens? You give an input, brain processed it. After processing, it gave a message to the muscle, and then you did some movement out of it. So when you're giving a correct amount of sensory input, brain is processing it, and if the brain is doing something in a positive way, what is going to happen? The child is going to get a confidence out of it, isn't it? So how the brain activity changes. So think, supposedly, if this is a pen, I was just doing this stimming, but my teacher trained me that this is used for writing, and I love to do writing. So do you think then I'm going to do this again? No. Now I know the correct use of it, and now I'm going to use it functionally. So when the proper input is given to my brain, and if the input which has been given to my brain is very clear for my brain, then what's going to happen is my brain activity is going to improve. So, as a result, how can you judge? How can, as a therapist or as a parent, you can judge that whether the brain activity has improved or not? Now, you can see a change in the behaviors. Now the child is more adaptive, he's more relaxed, and when you are putting something in front of him, he is not showing any tantrums.
Correct.
He is much relaxed person.
Correct.
He is now an independent child. Now, if you just you can see this in very commonly in the kids. So when they start doing certain things and they feel that I'm confident in doing it, so just leave them. They will just sit and try to do those things. A constructional play comes there. Na?
Yeah.
So my brain activity has turned into the positive thing, and now my brain activity is working in a positive manner.
Makes
So there
sense.
is an improvement in the confidence. There is an improvement that I can do it. Yes, I can do it. So the child will become more and more independent. Behaviors are going to reduce, and there will be a natural way of learning things, isn't
Got
it?
it. Got it. Got it. Makes
So
sense.
but again, it's very important the functional activities and just right challenge for the kid. It's very
Yeah.
important.
Yeah. Because I think like we under challenge kids, like we don't push them too much, or sometimes we over push them, and that causes like trauma, and that just like creates
Exactly,
anxiety. So
exactly.
just like balancing that. Yes, the prefrontal cortex develops too. That is correct, right? So like in the PFC, yeah, 100%. Yeah, and also like your amygdala, which is in for kids on the spectrum, it's in a very reactive space. With functional brain activity, that calms down, so your amygdala starts to respond rather than push against things and react and like
Absolutely,
do all of
absolutely. So
that.
all the inputs, all the sensory inputs, which is going to the cortex, is also going to the limbic system.
Correct.
Limbic system is a system which is actually controlling our emotions.
Correct.
So it's very important. So there will be an improvement in the emotions
A
also.
100%. Yes, I've seen that too. Like kids who are just like reacting, pushing, hitting, self-harming, like their behaviors just calm down and then chilling out a lot more. Okay, so we've already been speaking for 45 minutes. So one or two last questions before I'll just open it up to any other questions. My one of my personal last questions is, so if a kid, Roshan, is going to school 5 days a week, gets done at 4 p.m. How many days in a week do you recommend OT, for how much time, like all of that?
You know, Devangana, let me tell you one thing. Thanks to the COVID, because we used to study this tele-rehabilitation thing, but we never executed it. But in COVID, we learned to execute this tele-rehabilitation wali thing. Na, Sari, where we are taking now online sessions. Now,
Oh
let me tell
wow.
you. The thing is, how many sessions the child need. It's not about how many sessions the child needs, it's about how much time the parents can give to their child. I am a
Right.
professional. He is not my child. I cannot improve your child. See, you need to understand this thing. He's your child, you are a parent. The only thing is, as a parent, you don't know the direction, how to work, what is happening to my child, what should I do.
Hmm.
So as a professional, I'm giving you a plan, I'm giving you suggestions. Maybe I'm taking a lot of sessions of your child to make you learn how to execute the things if you have certain issues. But if you're not doing that at home and you want, okay sir, एक काम करो, आपके साथ तो बहुत अच्छा कर रहे हैं, 5 days की जगह 10 days बुला लो, दो sessions ले लो. No, that's not gonna happen.
True.
I'm a teacher, I'm not a parent.
Yeah.
So intensity, I think one session a week can also make a same impact which a 5 day session can do, depending upon how much effort the parent is giving. So, this is something running from one center to the other to the other. आज स्पीच है, फिर उसको ओटी जाने, ओटी के बाद स्पेशल है, स्पेशल के बाद एबीए, पूरा दिन पैक्ड है, मेरे पास तो टाइम ही नहीं है,
Yeah.
हाउ कैन आई वर्क विथ माई चाइल्ड. Actually, you are avoiding your child. You don't want to work with your child. That's you feel easier to go running around here and there
Hmm.
because आप अपने बच्चे के साथ टाइम नहीं बिताना चाहते.
बिल्कुल.
One session a week is also enough because in US or in any other UK or Australia, the parents are not getting enough sessions, but still the child are developing. Why? Because the parents are working with the kids. So one session
Totally.
in a week is also sufficient.
Okay, so there's a question, Roshan. For many sensory stimulation, does children with ASD have a high activity in thalamus? If I'm not wrong, thalamus is where all the sensations primarily pass by. So for a kid with ASD, is like their high activity in the thalamus.
Again, it's very, very, very difficult to say because thalamus is one of the junction where before going to the motor output, before going to the sensory cortex, you can say there is a junction where all the sensory input is first going to go to the thalamus,
Correct.
and from thalamus they are going to go to the sensory
Correct.
cortex. So I think supposedly if there is any problem in thalamus, it's very hard to say because you need a lot of like brain mapping for it to see that. But more or less, what we see is that it's more of the sensory cortex which is creating a mess in the brain other than the
Yeah.
thalamus. So
Yeah.
it's not the thalamus, it's the sensory cortex or maybe the supplementary premotor cortex area or maybe the cortex areas which are maybe they are not receiving the things properly or maybe they are not giving the output properly. But Devangna, it can be a little bit of a contradicting statement because we are working live. It's very hard, very, very, very hard to say. Obviously their problem is somewhere that can be on the dorsal medial lemniscus pathways, it can be on the thalamus, it can be on the internal lamina, it can be on the cortex area, maybe some spinothalamic tract, anything, or maybe there is no issue anywhere, but still the child is having the processing or sensory issues. So I think the answer will be given better by some neurologist who is actually working with the brain thing of this autism.
That's really interesting because like for me like now I run my own foundation which is Brain Bristle, and I rely on just like fully engaging your brain and emotions in an activity for all sensory issues to like calm down. But like of course like kids go back home and sometimes they act out and they do all of that. So I don't know, right? Like there must be so many things that need to work in tandem for a child on the spectrum to settle down. Any more questions? I actually have asked so many questions. I don't have any more right now, but yeah, brain is like a very complex organ. You're right. Thank you for that great question. Any other questions, Roshan? Anything you want to add that you wanted to add?
I think every child can perform, and there are two things which I want to say.
Yeah.
Be a happy parent. If
Yeah.
as a parents, you know what? We have two categories of parents. A parent who are always happy. Maybe
Yeah.
down the line at home they are not happy. Obviously they have an anxiety when they see their kid, but socially they are a happy parent. And we see a parent who are actually depressed. See, the thing you cannot do anything about about it. All you can do is first, as a parent, be a happy parent.
Yeah.
Okay.
Yeah.
Secondly, if you're happy and have a positive thing and just see the minor positivity in your kid on a
Yeah.
daily basis, on a weekly basis, and trust me, trust me, you can see if you will just see the minute changes, and if you'll accept that minute changes in your kid, you will feel very satisfied. And don't compare your child with anybody.
Totally.
Don't compare with any other kid.
Totally. Totally.
And for the therapist, I think there are a lot of therapists who are here. Don't be in stress while you are taking a session. Be a relaxed and happy therapist.
Yeah.
Always keep on smiling. Maybe you can have a difficult time when you're working with a child, but that's a thing which you can't control, and there is a thing, even fact, the poor kid also cannot control.
Yeah.
Always be a happy therapist. Don't take
Yeah.
stress. That's
Yeah.
the only thing.
Yeah, yeah, I know. I fully hear that. And I think it's hard sometimes in a space like autism, but it's so important, right? Yeah.
Yeah.
Okay, one last question. Some say by the age of 5 to 6, the brain develops the most. My son is 4.5. That means the best I can do is have 1.5 years. I can answer that. I think neuroplasticity is active till
Exactly.
like many later years of your life. You're giving your son too little time if you're thinking he'll be developed by 5 or 6. Just engage him in play and exploration and art and going out in the park and like coloring and doing all of that. I think we sometimes traumatize a child that by 5 or 6, we want them to meet all milestones, because I think the biggest sprouts sometimes happen in the teenage years when they're 14, 13, 12, 15. So I don't know. That's my perspective. That if I've also studied the brain because I've studied autism, and you have like the whole life of a child till 18 at least for absolute neuroplasticity, and much later also. Yeah.
Absolutely, Devang. You're
Yeah.
absolutely right.
Yeah. Anything else? Okay. Roshan, anything else you want to add as the last piece of advice? Because I love the space of autism. I think it's such an interesting space. Roshan, like in my last 16 years or so, I've met some of the most intelligent, creative geniuses who've been on the spectrum of autism. And I just feel like that's what keeps me stuck in this space, because it just fascinates me. So yeah. Anything else?
Absolutely. I can actually understand, because I have seen a lot of kids with the diagnosis of this spectrum.
Yeah.
They are doing wonders in their
Yeah.
life. You
Yeah.
know what? Maybe as a therapist, we can see a little bit of a up and down in the things, but normally nobody can even diagnose what's happening.
Totally.
So that's something I have seen. Have faith in God. Keep on working with your child.
Agreed.
Every child develops and every child learns. Maybe the pace can be up and down, but every child learns and every child improves. That's for sure.
Agreed. Agreed. I love that. Thank you so much. My son hates to write. He knows, but he doesn't push what can be done. Most boys hate to write. He doesn't have to be on the spectrum. But boys, there is like whole books and books written about boy writers. So my advice would be like give him a purpose for why he's writing. कि अच्छा बेटा अगर तुम्हें pocket money चाहिए, give me 5 reasons for why you should get pocket money, or give me 2 reasons for why you should get pocket money. Even if he draws, it's fine. So as somebody who runs a foundation which is about education for children on the spectrum, that's my advice. But Roshan, what do you say?
Absolutely, you are right. Because nowadays writing is not only a problem with the spectrum. It's with all the kids, I believe.
Yeah.
Now the kids are coming to be having no diagnosis, but they still hate to write. So, but ma'am, what I would suggest, you are seeing the writing, but you also need to see how much you have worked on the pre-writing skills. So, if you have not worked lot in the pre-writing skills, and if the kid does not have good fine motor skills or the gross motor skills, you are expecting more from your child.
Yeah.
So, work more on the grosser level, work more on the finer levels. I can assure you, you can see even better results, in better results. And secondly, ma'am, not every child can be a good writer. Okay.
Yeah.
So I don't know what case we are talking about. The second is that not every one of us is a good writer. I am a
Yeah, yeah,
pathetic
yeah.
writer, to be very frank. And you know what? When I listen and when I see a lot of things which Devangna writes, I actually have to sit with dictionary because I don't know what she's speaking, the terms she uses.
Yeah, yeah,
So
yeah.
I
No,
feel that
no.
I'm a
So
learning
literal.
disabled at that point.
Yeah,
So,
no. No,
so,
I
ma'am,
get it. I get it. But like even like basic writing, most kids, like most kids who are not even on the spectrum hate writing. So you have to like give them a timer saying like 10 minutes, we're gonna write a small moment about this morning at breakfast, right? And just like 10 minutes, I need 5 sentences, that's it. Or like, give them like 6 lines and put a dot. Be like, bus, small moment batao ki aaj subah when first thing you did when you went to school. So just like little things. I work with a kid who's got severe autism and fragile X, and right now we're reading a young adult fiction. And like I'll stop after every page and I'll ask him 3 questions. Be like, and sorry, why do you think Liz didn't talk to Wes? And like he'll write something like he'll write something like he hates him. So just like giving them small chunks, small tasks, I think sometimes helps. Anything else anyone has before we close
there is a
out with?
question about W sitting, how to work on that, ma'am. Just check. I think W sitting is basically when the child is having a very poor abdominal tone. So you need to work more on the abdominals. And if you're going to some therapist, just consult it. The child actually needs to work more on the abdominals, and you can see the decrease in the W
Yeah,
sitting.
yeah.
And I think we have, I think,
And Roshan,
are
I'm
we
gonna
done?
post this also. So like we've had such good conversation and questions. So I'll post this video for anyone to access, and you can share it. And like whoever hasn't
Absolutely.
been able to join live will be able to listen.
I'll share in my Insta also.
Awesome, 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 perfect, amazing. Roshan, thank you so much. Enjoy dinner. You are the best. You're still the same, and I'm so happy that you're still the same. So thank you.
Unfortunately, Devang, I'm not able to sue you because I don't know
I
what's
know,
the problem. Maybe it's from
I
my
know.
side or
So
your side.
when I post it, then you'll be able to
Yeah,
see. So it's
definitely.
it's all good.
Okay, it was
Awesome.
my
Okay,
pleasure to be here,
awesome.
and the
So
questions are
so
pretty
Roshan,
good.
I'm gonna post this right now, and I'll invite you as a collaborator. So just accept that. Okay.
Okay,
Okay. Awesome.
thank you, thank you. I'll do it.
Thank you everybody who joined. You guys rocked. Thank you. Thank you. Thank you. Have a good weekend. Bye. See you. Bye, Roshan.